Thank you. My name is David Rudoler, and as was mentioned, I'm a PhD candidate at the University of Toronto, and I had the great opportunity to work with Dr. Audrey Laporte on a paper for the Health Reform Observer, and perhaps it was poor judgment on her part, but she's letting me speak on her behalf today. So I wanted to talk about three things in my presentation, the brief minutes that I have. First, I wanted to just give an overview of the paper that we wrote and not really focus too much on the content because I don't have enough time to do that, but I also really wanted to focus on how we use the standardized format and how we address a lot of the questions that it raises, the way we approach the paper. I also want to talk about why we thought this case was a good one to focus on. And finally, just what we see as the opportunities for PHRAN and for the HRO. So we focused on the Personal Support Worker Registry in Ontario. And for those of you who are unfamiliar with PSWs, they're an unregulated health occupation in Ontario that provide frontline care, primarily assisting with the activities of daily living, instrumental activities of daily living, and some clinical interventions as well. They're sort of akin to home care support workers or healthcare aides in other provinces. So the registry was implemented in May 2011, but it's very much still in the implementation phase. And the objectives of the registry are to highlight the work that PSWs do, so to raise the profile of the occupation, to offer a platform for PSWs and their employers to more easily access the labor market, and to provide the ability to track information about PSWs, information that's currently very much lacking in Ontario, and so this provides a good opportunity to obtain more information about this important occupation. So the intention is for the registration to be mandatory for all PSWs, although currently it's still voluntary. And it's intended to be mandatory for all publicly funded healthcare organizations. And currently the registry collects information about educational background, work experience, and some contact information. So the information is relatively limited at this point. So that provides you sort of the background on what we were looking at. But I wanted to focus on the format of the article and the questions that we were intended to answer to give you an idea of how we approached it. So one of the questions is the factors that led to reform. And this is really an opportunity to use some policy theory, primarily using the Kingdon policy window framework, and really ask the question about what factors led to this reform, what windows of opportunity opened that brought this onto the government's formal policy agenda. And so in our paper, we talk about the increasing size and role of home and community care in Ontario and the prominent role that PSWs play in this sector. We know that they provide a majority of the formal healthcare services in this sector. And increasingly, individuals are being discharged from hospital more quickly at higher levels of complexity, and so more pressure is being put on this occupation to care for an increasingly complex patient population. And we also looked at the views of various stakeholder groups and what influence they had on bringing this onto the formal policy agenda. And we also had to answer the question, how was this implemented? And part of this, the way we approached it, was to consider why was it implemented in this way as opposed to other ways. And so we looked at the type of policy instrument that this was, and the real tension with respect to the PSW registry is registration versus the creation of a registry, or perhaps neither of those in some other approach. So why was this approach taken versus others? And of course, we also completed the paper with the SWOT analysis, looking at the strengths, weaknesses, opportunities, and threats of this health reform. So in terms of strengths and weaknesses, this is something that, my background as a policy analyst, I'm very familiar with. Have to do pros and cons for any sort of policy recommendations that you're bringing forward, and so took a similar approach here. And in terms of strengths and weaknesses, obviously data collections and access to labor market, the stated objectives are strengths. Weaknesses, there's obviously costs associated with this, and the fact that there's currently no enforcement mechanism to require PSWs to register at this point, or require employers to only hire registered PSWs, it sort of limits the strength of the intervention. In terms of opportunities and threats, approached it as a way of opportunities, looking at how the reform could be possibly expanded to increase its benefit, and threats, things that are exogenous to the policy intervention that may limit its effectiveness. So why do we choose this case, and why do we think it's good for this particular, for the Health Reform Observer, a good case to look at? Well, Ontario is, as far as we know, the third province in Canada to implement a registry of this type, BC being one of the other provinces. And in each case, it's been implemented in a slightly different way with slightly different policy objectives. So in terms of comparative analysis across the country, it's an interesting case. The registry is being implemented in Ontario with very little precedence other than what's going on in these other two provinces, and with little evidence and with some controversy. It's not unanimously supported by all stakeholder groups. And of course, the health reform is important in of itself because of the cost implications and the impacts it may have on long-term for the PSW occupation. In terms of opportunities and our general experience working with this format, it's been a very positive experience. Like I said, it's sort of a format that I'm familiar with, coming from a background working in the government, and it feels like a similar format to that. And it's something different than we normally do, or I'm used to doing now in my academic role. But I think the real strength of it is the opportunity to learn about reforms as they happen. So if a paper is written on each large-scale policy initiative that comes forward out of each province, it really could create a central repository that everyone could go to find out what's going on in other provinces and how are other provinces addressing similar issues. And so it's really an opportunity to share information across provinces and perhaps even build some interjurisdictional research partnerships that don't currently exist. You can find out what other people are interested in and in other provinces, and perhaps turn this into something larger scale, a larger scale comparative policy analysis. And I think it's beneficial not only to to researchers, but policymakers as well. Certainly in my former role, I was asked on numerous occasions to look at what other jurisdictions are doing before going forward with any recommendations. And that was usually an arduous task, and because you'd have to go to multiple sources to find out what's really going on. And this would be a very good resource for those individuals as well. So thank you for your time. I look forward to the discussion.